Video begins with a shot of a nurse talking to a patient in a hospital room. Hello, future nurses and healthcare pros. Welcome back to our channel. Today, we're diving into a common clinical scenario you will definitely encounter: caring for a patient with irritable bowel syndrome or IBS. Let's set the scene. You're admitting a patient who has just been diagnosed with IBS. They're feeling anxious, uncomfortable, and looking to you for guidance. As their nurse, what is the most important initial action you should take? Here are your options. Think carefully. Is it A? Recognize that IBS is a psychogenic illness that can't be definitively diagnosed? B. Develop a trusting relationship with the patient to provide support and symptomatic care? C. Teach the patient that a high-fiber diet will relieve all their symptoms? Or D. Inform the patient that new, universally effective medications are available? If you chose B, you are absolutely correct. Let's break down why. IBS is a complex functional GI disorder. This means it causes real, disruptive symptoms, like abdominal pain and changes in bowel habits, but without any visible structural damage to the gut. Because of this, it can be a frustrating and often misunderstood condition for patients. This is where you, the nurse, become so crucial. Establishing a strong, trusting relationship is the cornerstone of effective IBS care. Patients need to feel heard, believed, and supported. Psychological factors like stress and anxiety are well-known triggers that can make symptoms much worse. By creating a safe space for them to share their concerns, you provide invaluable emotional support, which directly impacts their physical well-being. This trust also encourages them to adhere to the personalized treatment plan we develop together. Now, let's quickly look at why the other options aren't the best first step. Option A is incorrect, because while stress plays a role, IBS is not purely a psychological illness. It's a real physiological disorder diagnosed using specific criteria, like the Rome I-4 guidelines. Option C is a common misconception. While a high-fiber diet might help someone with constipation-predominant IBS, it can actually worsen symptoms like bloating and diarrhea for others. Dietary advice for IBS must be highly individualized, often involving a process of elimination like the low FODMAP diet. And finally, option D is misleading. While there are medications for IBS, there isn't a single magic pill that works for everyone. Treatment depends entirely on the patient's main symptoms, whether it's diarrhea predominant or constipation predominant. Lifestyle and diet management are always the primary focus. So, what's the key takeaway? When caring for a patient with IBS, always start with building a foundation of trust and support. A great way to remember this is the mnemonic. C. A-R-E, communicate openly, assess their unique symptoms, reassure them that their symptoms are real, and educate them on their personalized management plan. I hope this helps you feel more confident in managing this common condition. If you found this video helpful, please give it a thumbs up, and don't forget to subscribe for more nursing tips and clinical scenarios. Thanks for watching, and see you in the next video.